Hi friends, welcome back. I'm Quenby Gallahan, a licensed marriage and family therapist here in the state of California. I've been a therapist here for well over a decade. I think I'm actually going on 15 years. And this channel is all about mental health, personal growth, and I do a lot of videos on counseling and counseling tips. So be sure to subscribe and turn on that little bell. That will notify you when a new video comes out. Today we are talking about non-medication treatment options for depression. So this video is great for you if you're someone who's been given a diagnosis of depression yourself, or you know or care about someone who has, or you work in the mental health field in some way. Let me first start off by saying I don't have anything against taking medication for depression. I have seen it greatly benefit some of my clients. I do have some clients that don't want to take medication for depression, or they've tried medication and it did not work for them in the way they want, or they couldn't deal with the side effects. So this is something you definitely want to talk to your psychiatrist or physician about as well. Research shows that the combination of psychotherapy and medicine together is the most effective for treating depression. Of course, I'm a psychotherapist. I'm a licensed marriage and family therapist, so I'm going to plug therapy. Therapy can help in so many ways if you're struggling with depression. Just to name a few, therapy works a lot at the level of cognition, your thoughts. So in therapy, we take a look at your thoughts and how they're making you feel, and we try and replace negative thoughts with healthier thoughts, with more helpful thoughts. And now that we have brain imaging, we have ways to see how going to therapy and changing your thoughts, it not only changes your thoughts, but it changes your actual brain. This is called neuroplasticity. But regardless of whether you choose to take medication or not, there are some things that all of us can do with our lifestyle. We can make healthy changes to our habits and our schedule and our routines that can help improve your well-being and overall mood and fight depression. This is often called lifestyle medicine, and I use lifestyle medicine with my clients regardless of whether they take medication or not. These are things that could benefit all of us with any kind of mood issues. So I'll be referring to my depression lifestyle medicine checklist. This is a checklist that I created to use with clients. It has 10 lifestyle medicine suggestions. So this could be great for you if you want to work on depression in your own life, or if you are a counselor or something that works with clients. This is something that you could go over with them. And it also has a place for you to evaluate each one of the lifestyle medicine items on the checklist. This is available in my Etsy store for $5. That's a great way on Etsy to get all my tools to you. The links for that are in my description section. I have all sorts of therapy, counseling type tools over there, including my teen question cards, and I've made anxiety management flashcards, and I've gotten really great feedback from all of you. So thank you to anyone who's gone over to Etsy to use those. So I have 10 things on the list. I'll probably just choose to go over a few to give you an idea, and then if you want more information, you can look for that checklist. So I go over these things with clients who present with depression. Things like sleep, diet, exercise, morning routine. So let's talk just about a few of these. Sleep is huge for people that suffer from depression. There have been clients who fix their sleep issues and it fixes their depression. And depression and insomnia and sleep issues seem to go hand in hand, so it's definitely something that you'll want to address. I like to offer a lot of education about what's called sleep hygiene. So I'll talk to my clients and say, how is your sleep? Where are your sleep issues? Do you have trouble getting to sleep, to fall asleep? Do you wake up in the night? And we go over all the things that they could do to improve their sleep. Things like sleeping in a dark, quiet room. Maybe your client needs to get a face mask, or some people need to have a fan in the room. Some people do well with a weighted therapy blanket. It helps them with their anxiety and it helps to ground them. I talk to clients about not having too much caffeine in soda, tea, coffee, because that can affect your sleep when it comes to bedtime. So I'll throw in a little tip now. I just want to encourage you not to discount Making lifestyle changes. Some people will think, well, my depression's too severe. Sleep and exercise is not going to help me, but it can. You can have a lot of hope that you can feel better because these things actually work for people. Another lifestyle factor that I like to go over with my clients is a morning routine. Many people wake up, and people with depression sometimes wake up and just think, oh my gosh, how do I do this day? Another day. And many people wake up and they get right on their phone. And I'm going to suggest that changing your habits in the morning, changing your morning routine can help support the rest of your day. So try and wake up and create a morning routine of some self-care and some feel-good practices, such as waking up and doing a few minutes of meditation or stretching or yoga, or lighting a candle and setting your intention for the day. Start your day in a healthy way rather than right on your screen with the news and the media. Evaluating your screen time use. How much time are you spending on your phone, on your tablet, on your computer? How much news are you watching? And how does it make you feel? It might be that you need to limit your media consumption, that you are someone who likes to be informed, for example, and you're going to watch the news, but you're not going to watch it all day over and over. You're going to choose an amount of time that you're willing to watch the news to be informed, but not spending the day listening to very challenging content on the news. Friends, please take a moment and make sure you're subscribed to the channel. And if you turn on that little bell, you get notified when a new video comes out. Another one of my favorites on the lifestyle medicine checklist is journaling. I love to encourage my clients to journal. Sometimes we'll do it in session because they'll say it's hard for them to do at home, or I'll give them journal prompts to take home with them, or I encourage people with depression to start journaling. Why? Journaling really helps us express ourselves and get out our thoughts and feelings. So as you write down different thoughts and feelings you have, you're going to start identifying patterns. What people, what situations, what events cause you to go into a spiral of negative thinking that causes you to feel pretty bad emotionally? When you identify these triggers and when you become more conscious of them, then you have more control and you can make some changes and say, when I spend 2 hours at my family's, I feel really awful after. But if I can go and just spend an hour and set good boundaries and leave, I feel much better. That's a doable amount of time with my family because too much gets me a little too triggered and I feel bad afterward. You begin to kind of identify these patterns and you can make healthy changes. Let's talk about social time. The thing about depression is that it can trick you. Depression is saying negative things to you all the time. It's a very critical voice in your mind. And often depression will tell you to isolate yourself, to stay at home, to be by yourself, to not get out there and do things and see people. That is how depression sounds, but isolation can be one of the hardest, harmful things for people with depression. We are social creatures. We are hardwired for connection. We need time with people. I'm a total introvert. I don't need as much time as some people who are more extroverted, but sometimes I have to push myself to go out and see some people, connect with people, go to dinner with friends, talk to someone on the phone. And we all need support. We need social support from friends and family and people we care about. So sometimes you may have to push yourself a little bit to get out there, to go to class, to go to church, to go to the gym where you might talk to a few people, to accept that coffee date with a friend you haven't seen in a while. Depression's going to tell you not to, just to stay at home and chill out and be by yourself. But isolation makes depression worse. Okay, I'll talk about one more and then let me know if you would like a further video on these things. Let's talk about purpose and meaning. When I talk about purpose and meaning, I always think of Viktor Frankl and his book, Man's Search for Meaning. You could Google all about him, but essentially he was a psychiatrist, he's a Holocaust survivor, and he wrote a book on how he survived this when all his friends and family had died, when he saw horrific things. And he writes about this idea that having a sense of meaning and purpose is what got him through that. He really needed to come through this alive and tell his story and share it with the world, so that got him through. And it's taught us something in the world of psychology, that people feel better and do better when they have a sense of purpose and meaning in their life. So I think it's important to evaluate that for yourself. You can think about what brings you meaning in life, what brings you joy. When do you feel your very best self? It'd be something great to journal about and clarify that for yourself so that when you're going through hard times, you can remember what you're doing here. So people who have a clear sense of direction, of life purpose and meaning, allow that to motivate them. And people with depression are often struggling with motivation. It is hard sometimes to just make yourself get up and journal, get up and be social. But having something that's driving you, that's subjective, that's personal to you, that you know is what you came to this earth to do, can really help inspire and motivate you. So we didn't get to go over everything on the list. I wanted to talk about diet, exercise, caffeine, nature, but feel free to go over on Etsy and find this list. I've made it available for you to use for yourself or with clients or people you care about that might be struggling with depression. Feel free to leave any comments or questions in the comment section, and I'll see you in my next video. Thanks for watching.